Welcome back to The Short Coat. Coming to you from the amazing and intense world of med school at the University of Iowa, Carver College of Medicine. I'm Dave Etler, and I don't know about you, Cory, but I'm ready to talk about what social media is telling you and your future patients these days.
I'm so ready.
Okay. To help me with this not at all serious topic, I'm joined by my medical student co-hosts, like the aforementioned M1, Cory, Karasek? Karasek. I did look it up, and I forgot.
You did a great job.
The not yet mentioned, but soon to be mentioned M1, Issa Perez Sandy.
Hi, guys.
The hereby mentioned M2 Maria Schapfel.
Hello, hello.
And the oft mentioned M3 Fallon Jung.
Yellow.
So I asked you guys to bring in some of the social media stuff you found so we can react to it as a cozy little group, because honestly, I didn't want to spend a lot of time coming up with writing things on my own to talk about today. That's how that works. So are you ready to get jiggy with it?
Yeah.
Yep, I think. Yeah.
What does that mean?
It's like I just haven't heard that phrase in a while.
It always reminds me of Scooby-Doo 2. Monsters Unleashed.
Okay.
That's a deep
Never saw that movie. Might have been outside my demographic.
What?
I didn't see Scooby-Doo 1 either.
I'm sure
I haven't seen it either, Dave. If it makes you feel better.
Yeah, actually, I'm not sure if I have seen it.
Seriously, guys.
I was
Freddie
not
Prinze Jr., Michelle Gellar.
Okay. Wait a minute.
Or Sarah Michelle Gellar. That's
Let's
me.
derail the show for a moment. Rachel, in admissions, says that I look like Freddie Prinze Jr. Or my younger self look like Freddie Prinze Jr.
I don't know.
Okay, I don't know
who
what
that
your
is.
younger
I have
self
no
looks
idea who
like.
Freddie Prinze Jr. is.
Yes, you do. You know who Freddie Prinze Jr. is. Hold on. We need to
Pull up a
fix
picture
this.
right now.
Yeah.
Yes, you guys totally know who Freddie
need a
Prinze
face.
Jr. is. He is literally Freddie. He is the face of Freddie.
The face of Freddie to me is animated.
Yeah.
Yeah.
Oh my god.
I don't
would
know
agree
which one Freddie is though.
Hold on. I have to find like a young picture of him. Hold on. I
know
have to
there's
put in Scooby-Doo just so that we're all...
Oh.
Oh, thank you. Yeah.
Wait.
Yeah.
I could see that.
Here's Freddie. Now, look at me.
No, I could see that.
I could see it.
What the
I
hell?
don't.
If you put
I don't.
like an Instagram like age up filter on that man, I wouldn't be surprised if like your face came out the other side.
Yeah, okay.
Especially if he had curly hair.
Yeah.
Yeah, if he had in that. Yeah, he doesn't have curly hair.
I still can't see it, no matter what you crazy people say.
You'd make a good Freddie, Dave.
Okay. Anyway, shall we begin?
Yeah.
Shall.
All right. I neglected to take any notes. So here we go with the first one. It's random. I don't know which one it is. Ready?
I never asked, what specialty are you interested in?
Oh, I'm loving my time on this rotation so far. I'm like a stem cell. I'm pluripotent. Maybe this specialty. I'm keeping my options open. I have a short list, but I'm trying to narrow it down. Honestly, leaning towards this. I just want to focus on the fundamentals before committing. I'm trying to keep an open mind. It honestly depends on the day and how much sleep I've had. Oh, I'm excited to explore everything before deciding. I have no clue.
So this is obviously referring to the fact that on every rotation, and in fact in every communication, once you get into clinical years, Fallon, people start asking you what
Yes.
Ain't that the truth?
what specialty you're
Yeah.
going to be in.
Have you been asked yet?
Oh, all the time. I sent this because my understanding of the prompt was not like I didn't think it was misinformation, and I was like, this is the only thing that I have on my feed, so I'm gonna send this.
It's fine.
Yeah, I actually had an attending. He was like, oh, like, what do you want to go into? I was like, I have no idea, not a clue. And he was like, so you're pluripotent? And then I was like, I guess I am. And now I've been telling people that, and they're like, you're ridiculous. And I'm like, but it's true. And it's better than being like, I'm keeping my options open. I think it's fun.
There are
Pluripotent.
schools of thought.
Yeah, right.
There are schools of thought about answering this question, aren't there?
Yes. You say you're interested in absolutely everything, even if you are not interested in what you're doing.
So no matter what rotation you're on,
Yep.
no matter what clerkship you're on, you're interested in that clerkship.
Absolutely.
I don't agree with this.
I don't either. I don't like
I
it.
don't really agree with it either, but I can see why people do it.
Well, are you
Yeah.
afraid you're like gonna burn a bridge like with the rotation you're on? Like, I absolutely don't want to be a urologist, and you're like on your urology
But
rotation.
I loved urology. I
Oh,
had
yeah.
urology first. I loved it. It was great. I think it's twofold. I think one is like, if you're like, no, I absolutely don't want to go into psych, then like, I think from like the whatever resident attending perspective, it's like, okay, like this kid doesn't want to be here. Whereas like, okay, hypothetically, if I didn't want to go into psych, I still like will never have the chance to do whatever I'm doing in my psych rotation ever again. So like I might as well like make the most of that.
Yes, this is the correct answer to the question.
Yeah, I feel like you can just be honest.
I'm not. I don't know if psych is what I want to go into, but I'm here to learn as much as I can about it because I don't really know.
Right, exactly. And I think like that's probably and I think that's the right attitude, because also it's like we pay money to go here, so I am what a concept. I know. And
Cory hasn't even been billed yet.
That's crazy.
You aren't paying to be here, Cory?
No, bro, they're paying me.
But I'm also like, if I'm paying money to be here, like I better be learning something from my time.
That's fair.
Got to get as much as you can out of this.
Right, because they're paying everybody else, but
yeah, not you.
yeah, not me.
Fallon, what's your routine answer? Be
My
honest.
routine answer is I think I'm interested in family medicine, but because family medicine is so broad, there's always something for me to learn on this rotation. And also I want to know what happens in specialty situations so that I either know what to like tell my patients what's going to happen, or I can do a really good workup before I send them to a specialist.
Love that.
That's a lovely
perfect answer. Even better than mine.
Perfect.
Which I don't have to give. So I don't know why I called it my answer, but
I think like it's hard, like say hypothetically like you did want to go into urology. I doubt many med students like go into med school being like, oh my god, urology is like my calling. A lot are like ortho, but like I think with like that type of specialty like interest, I think it's hard. Like family med, that answer works really well because it's so broad.
Really broad.
But if you want to go more narrow, I think sometimes it can be like
It's difficult.
okay, so there's still room for my answer. I love that.
Yeah,
Definitely.
And also too, like I knew nothing about urology going into it, and then I loved it, and then I was like, well, like how was I supposed to know that this was something that I would have a good time in?
You can't know. That's why.
No, right? Exactly.
Yeah. I mean, my first was surgery, and I was like, I am never going to be a surgeon. And surgery was like literally my most favorite.
Oh.
And so, like, you just don't know.
never know.
Yeah.
So
I'm
Okay.
excited. I can't wait.
No, I'm not at that point yet, but people still ask you all the time. And I'm doing pediatrics, period. No matter what.
So you have a strong
okay,
idea.
but Cory,
but I
there's
can
been a
say-
lot of like pediatric transfer to.
It won't, Maria, look at me.
That's
Will
what
not
you
happen.
think. Listen, it's what you
They're
think.
adamant.
Wait, what are you saying? There's been a lot of what?
There's a lot of people that are diehard, whatever.
Particularly peds, I think.
Particularly peds, but also like I think ortho bros also like die hard ortho bros and then they switch.
Well, I think it's because it's really hard to get into ortho.
Yeah, but see, peds is not.
No, peds is
No,
not hard, but
no.
I have at least 2 to 3 people in mind right now.
No,
who,
I do
like,
too.
Yeah, that were like, all I want to do is peds. Like, I'm going to be a pediatrician. And then they went to OB.
Yeah.
And they were like, oh, I actually think that this is what I care about.
Right.
Anyway, that's not to say that that'll happen to you because
Right.
like I went in like pretty sure that I was going to do family med and like I'm pretty sure I'm still going to
Yeah.
do family med.
Yeah.
But like, the world is your oyster. So just like, enjoy it.
I just think the world is my oyster within peds. So like if I get to cardiology and I'm like, wow, cardiology is so cool. I'm going to do this. I'm going to do
cardio?
pediatrics.
That's fair. That's fair.
Yeah, that's fair.
I mean, Chris Cooper is our dean is a pediatric urologist.
Yeah,
oh my gosh,
exactly.
you could do both. Pediatric urology is actually cool.
It's so cool.
Yeah.
Yeah.
So
But
All right.
then to do that, you would have to do urology and then peds.
Yeah, and see, I don't know about all that.
That's fair. That's fair.
you might be worth it. I'm just saying surgery is very fun. Okay.
No, low key, being in the OR is really fun.
Right. It really is.
Yeah.
Okay.
You
That's
just
all.
get to listen to music and like have a good time. It's a vibe.
All right.
I mean, there's other stuff obviously, but
Like suturing. Okay.
yeah, and
Like actual
stapling.
surgery, but
All right. Shall we move on to the next one?
Yes.
I'm Coffee, and she's on her 3rd cup today.
Mommy, my heart is beating so fast. I can't break down caffeine like you can.
There's no safe amount of me during pregnancy. None. Not even a sip. I cross directly into your baby's bloodstream through the placenta. Raising your core body temperature above 102 degrees in the first trimester increases risk of neural tube defects and miscarriage. 10 minutes in me can do that.
Good Lord.
Your cat is innocent, but I might contain toxoplasma, a parasite that lives in cat feces.
Make sure to wear gloves.
You finally found a page dedicated to life hacks. Follow @lifehack for more original daily videos.
Oh, damn.
This is a new genre.
that?
This is
I did. That's
this
a
is
good
the newest genre of social media posts.
Yeah.
My heartbeat's
AI,
like...
like my basal like stress response is like up right now. Like I did a deep dive on Facebook because I was like, I feel like that's maybe where people are seeing some of these some of these life hack videos. And I found that one. I was like, some of these takes are actually like good, but just the
bombastic
format.
Right.
Yeah, I was like, dang. And maybe that's the point to like get people to listen, but I don't know. I'm just like,
I think the point is to get people to watch their videos so that they can sell ads. The channel is called Life Hack. It's not called like health for good for you.
Do they actually care about health?
Yeah. But yeah, this is like the new genre of social media videos where they use AI to make these animations, and they're kind of weird looking. I found one that will come at least very similar idea, but which made me crack up. So we'll hear more about that later. How do you feel about this as a way of educating patients?
AI or like this video format?
This kind of video format.
Yeah.
I mean,
Well, it's not incorrect.
It's not incorrect, but it's also not really like educating.
Yeah.
Because
Like
it's just
fear
like
mongering.
it's fear mongering.
Yeah.
I don't like specifically this kind of video because I feel like it gives a really easy way to place blame on the parent carrying the baby if something goes wrong with the pregnancy.
Yeah.
But
OB.
also, I feel like I wish that it would. Hey, just
calling
consider
it now.
my patients later. But like, I also don't think it's educating because it's not like giving reasoning. Like, it's just saying things, and I think like that would never fly if like you couldn't call that patient education.
Hang on.
No. Yeah.
10 minutes in a hot tub is going to give your baby neural tube defects? Is that?
You can go up to 10 minutes.
Oh.
But it's
up to 10 minutes, and then after that.
Is that based in science?
There's actually like some pretty good books out there about like the data and the research on those types of things. And yeah, up to 10 minutes is sort of the
Okay.
Yeah.
Because I know sometimes a lot of recommendations come from sort of, I guess, common sense. Like, this is how I think this might be, but it turns out maybe that's not the way it is, really.
Yeah.
Yeah.
when people waffle on the coffee thing all the time.
Up to 200 milligrams.
Right.
Is like the general.
And the drinking thing, I mean.
Don't drink while you're pregnant. I feel good about saying that. Don't drink while you're pregnant.
I actually
the toxo thing.
Yeah, I didn't know about that until I learned this obscure fact in a pathophys class. Oh, pregnant women shouldn't be changing cat litter.
I do feel like that's a weird fact you like pick up like before med school, and you're just like, okay, whatever. Like,
yeah, cat litter and gardening.
Gardening.
Yeah.
What's wrong with gardening?
Poop.
Oh,
it's like the same thing. Yeah.
Right. Fertilizer.
Yeah.
Okay. Let's do the next one.
My name is Paul. I'm going to be doing a physical exam today. I have about 7 minutes for this encounter. I'm going to be talking to my preceptor after this and reporting your findings. Did you find the clinic okay? Was the weather okay?
Me too. Me too. He's
med student doing.
I honestly have no idea what I'm doing with this. So, what brings you in today? Your chief complaint is dysuria? Huh? It burns when you pee. How the heck do you lower this bed? I'm just gonna pretend that you're lowered down. Nerves. I'm so sorry. I would like to name your emotion. Okay. Oh, by the way, since it took you so long to get on the table, do I get extra time? I understand that this is very difficult for you. It makes sense that you feel that way. I always mess this up, so maybe you can drape yourself. I will now touch your belly. It's my SMART goal. I will now examine your belly. Is it here? Are you plagued by anhedonia? I'm going to do the ear exam next. It's a kazoo. Heck. I'm going to pretend I did vitals. Do you have any questions at all? I'm going to talk to my preceptor, come up with a plan, and we'll come back in together.
Yeah.
Just for the listeners, that's a med student, supposed to be a med student doing an objective, structured clinical examination,
Yes.
which involves working with fake patients. There's a few okay, so it's great. The fake patients are great.
They're quite well.
It's a great way to learn.
Yeah.
We prefer to call them standardized patients
Yes.
or simulated patients. But you guys always call them fake patients.
Sometimes they're a little like too fake.
Can I tell you my favorite story about fake patients lately is out in the hallway. So they do these right outside my office.
Yeah.
And a couple of times now, I have been spurred into angry action.
Wow.
Because I didn't understand what I was hearing. So yesterday, the patient instructors, who are also the simulated patients, they were, doing some exercise, and I guess it was an angry patient, and I keep hearing, and I heard like, "You've kept me waiting for that," and I'm like, who's yelling at my friends?
Unacceptable.
Who's yelling at my friends? So,
Yeah, the M1s just did the angry sad
Yeah, we were in the
patients.
same room.
Oh yeah, we were in the
Yeah.
same. It's so fun. I
They're
love
really
the angry
good.
patients. They are really good.
Wow. Honestly, when I did my angry patient, I was anxious about that specific session for like 2 days beforehand.
I didn't even know it was happening.
No,
I
yeah,
walked in
just
the
like-
day of, and they were like, "This one's gonna be angry."
Oh, this is
sometimes
happening.
it's best not to know what you're
Right.
getting.
Oh my gosh, yeah. I got in there, my heart was the whole
It's
time.
so funny though because like it's like fake. And sometimes, like, I remember people in my group were trying not to laugh.
Yeah, it's a little
like-
hard sometimes. Yeah.
Well, also because it's just like sometimes like so, not like this obviously happens, but sometimes like so ridiculous like that it would happen in this way.
Yeah.
That's like,
I used
and
to.
it's fake. Like it's funny.
I used to work with the group that when I first came here, I worked with the group that does those encounters, and I had to buy chunky soup to serve as vomit. So he would hold it in his, the patient would hold it in his mouth until they opened the door, and they would be like,
Really committing to the bid.
and it was really gross to clean up. I mean, they would get it in the trash, but like, no matter what, if you label something, what I discovered is for me anyway, if you label the most innocuous thing vomit, when you go to clean it up, you're going to gag.
Yeah. Yeah.
Wait, do they still do that?
I don't
No,
think so.
no.
Okay.
I don't think
No.
that's one they use
think we should
anymore.
bring
That's probably because I had too many people actually vomit in real life after that. That is horrendous.
Also, it just sounds like a pain to deal with.
Maybe a waste of soup.
That's probably
Look,
true.
you're gonna. Maybe he enjoys the soup while he's holding it in his mouth.
I'd love to have just a mouthful of soup.
Is it at
Only to
least
quickly
warm?
spit it out.
Like,
like
cold
straight from
soup?
the
in
can,
your
I think.
mouth.
Oh, cold soup would make me vom too. Oh.
Such a weird thing. I'd be like, "Yep, got me some soup for puke."
Ew, Dave,
to the
when did
store,
this
bought some
happen?
This is when they first started up the program, so like 2002 or something. I was
Okay.
I was among the first employees in that group.
It was a different time back
It was a
then.
different time.
Yeah. You guys might not even been born.
Oh
I was
shit! What did you just say?
No, I'm being serious.
It's also
Issa and I wrote
I
2003.
declined. Oh yeah, I was like,
Sorry,
I declined to comment.
I'm doubting you.
Babies.
that's crazy.
Babies.
I know.
I mean, it's obvious, but it's also sometimes it hits me, and it's like, what in the world? How am I still in Iowa?
I think that's the question everybody who lives in Iowa is asking themselves. How
I think
am I
that's
still
a
in Iowa?
question that everybody who's not from Iowa that is in Iowa
Right.
is asking themselves.
That's correct.
But then how did I? Yeah, okay, whatever. I'm not going to go on about it. Sometimes it's a little weird to think about.
Yeah.
Move back to Massachusetts.
Someday.
I know.
Oh, you're from Massachusetts?
I am.
Yeah.
Oh, I didn't
Dave and I
realize
are
that.
buds.
Yeah,
Yeah.
we've bonded many times
Yeah.
over our love for our home, our
Our
homeland.
homeland.
Are you from like this coast, or are you from inland Massachusetts?
I'm from like outside of Boston, so I don't know. It's like 2
The
hours.
coasties? The coastie part?
Yeah. I mean, it's not that far from the coast.
I mean, it makes a difference.
No, I'm not from like Western Mass.
Yeah, God forbid.
Western Mass is great though. It's really nice.
That's where I was for years before I came out here. So.
Yeah.
Anything more we want to say about Oskies? They're just a little bit of a.
He did a really lovely job.
Yeah.
I think it was really.
He
I'm
caught
just gonna
a lot.
pretend.
Yeah.
That,
Yeah.
right?
I
love
partial credit for
the slap on, because with the new trauma informed stuff, which is obviously like perfect and we need to do it.
Yeah.
But it is like they're like, don't say bed, don't say. So I'm like, why don't you hop up on the table
furniture.
this platform that I have here for you that has no value assigned to it. Why don't you get on up there?
Yeah, just hop on up, you.
But not for me.
Not for me.
Just for the exam.
If you wanted to.
Yeah, if that's okay.
The number of times that I go, if you just want to go ahead and do this for me, and then I'm like, no,
don't give them a choice, but also make them think that they have a choice.
They have a choice that it's not for me.
It's for you.
It's for you.
If you want to jump up for you,
you can go ahead and do that.
No, I really loved when we had our musculoskeletal exam, like portion of the exam. I was thinking, like joking with my friends beforehand, because the exam is a lot of like asking the patient to do different movements, like flex your leg, flex your arm. And I was like, what if we just like took a pause and like, can you do this for me? Like do the wave.
And get all those motions at once.
Just start like break dancing. Like, can you do this for me? Like, that might be funny.
the Cotton Eye Joe.
Yeah.
That's what they do with
Hit the
babies.
whip.
They do the Cotton Eye Joe.
They do not. Well, not that I've seen. Listen, when I make it to pediatrics, I will make my patients do the Cotton Eye Joe just for you, Fallon. No, they dance the babies around and they make the babies think they're having fun, but then it's like they're secretly watching to make sure their limbs move the right way.
Yeah.
Next.
Yes.
Yeah.
All right, I'll have you take a seat out in the lobby, and we'll call you back when we get a room. All right? No, my shoulder. Not a single room's open. Why? Currently full of emergencies. So that's fine. Let's wait till it breaks apart and falls off. It's good. It's fine. I'll be out here. Thank you. All right. Okay. Hey, sir, why are we screaming in the lobby right now? Because I'm telling this receptionist how much she sucks. So she gets me in a room because she sucks. Where has that ever worked? I'm gonna keep doing it until I get a room. Can I have one now? Even though I told you my back really hurts, you're still denying me carrying a room. Every room is full, and you've had it for 3 years. Well, my chest hurts. It hurts some. Hey, what are you doing? Pissing on the floor? Why? I'm mad. Stop! No, I called an ambulance, so I get a room. I get a room. See, it doesn't meet the... No, tell me why I don't get a room. Well, yeah, why? No, go on, tell me. No, tell me why. Explain. Go ahead, go on, tell me. I would like to.
The trials of being an emergency room physician, I guess.
Yeah, I sent that one in because he's a nurse, like an ER nurse, but his perspective, like his videos are just, they crack me up every time. Like, yeah. And I have a lot of respect for nurses, like just how much they put up with. Yeah.
You done ER?
I'm on it right now.
You're on it now?
Oh, you're on it?
How's it going?
Well, they just opened up like the psych wing of the ER recently, and they just opened up like the peds wing of the ER. It kind of blows my mind how those didn't exist here beforehand. Like, I kind of feel like, yeah, it's good if you have psych patients like in a quiet area, or like just
in an area that's designed
for them. Yeah. And also like having children in an area that is designed for their care, because I think like prior to like most of the psych patients I saw last night were like very calm, but then like there were a couple that were just like really, really unhappy to be there, and like rightfully so. Also, like not psych patients were unhappy to be there.
Yeah, no one loves being at the ER.
Nobody nobody would choose to, but it's also like you're putting like kids in that situation too. I was like, that like seems incorrect.
Yeah.
I mean, I'm kind of like of the perspective that like if you're not in a room and it's taking a while to be seen, that's a good thing for you. Like at like kind of like in general, maybe not for everyone, but it also means that you're not super emergent, most likely, which is
like if they're doing
I don't know, Fallon, you can.
Yeah, I was just gonna say if they're doing a good job triaging and like understand who's like the worst and they evaluate you.
Like you don't really want to like show up and be like, oh my gosh,
get in right now,
right? Like I think that's
What if the triage nurse was like, good news, you are not dying.
I would like that.
You are not dying.
Perspective shift.
Amazing for you that you are not dying. So we're going to take some dying people and put them in here first.
Yeah.
But I promise you, we will get to you in 5 hours.
After they're done.
After they're done.
Yeah. Yeah. And like sometimes it's like, oh, like I should
really teach.
Yeah,
you should.
You should. Well, because I felt bad because like someone was like waiting for like a couple hours, and then there was like a trauma that came in, and another like
you get bumped,
right? And I was like, okay,
it's not a first come first serve situation.
I'm not gonna I'm gonna go like do these other things that are more emergent.
Yeah. Life hack here in Iowa City: go to the ER at the downtown campus, not the ER at the main hospital campus.
True that, yeah.
I went with my wife months ago, and it was like a 5-minute wait versus a 4-hour wait. So, life hack here in Iowa City.
And if you have a ortho complaint, go to the ER at North Liberty.
Oh, okay.
Because that's where all the ortho people are. And actually, if you go to the North Liberty ER and you have like something more severe than a bone thing that they can't deal with, they will send you here.
Okay.
So,
or just go wherever the ambulance takes you. They know. They know where.
Right. Yeah. I will say though, like I thought I actually have no idea. Last night was my first night in adults, so not a clue. It wasn't as like people on beds everywhere as I think it could have been, but also I think a lot of that was like they were like, now we have like the new psych wing and like we have space for people, which I think is good.
We'll fill it up.
Yeah,
we'll fill up all this.
No, I mean I have no idea, but it looked like there were like rooms available and like spaces available, but I not a clue. It was busy, but I don't think it was like
just suck it all in.
I don't know.
Here's what you should do. When you go back tonight, you should walk in and say, wow, it's quiet in here.
Don't say that. Oh my God.
That would be really
I'm going to Peds tonight. So like that's like a whole different
Actually,
situation.
Peds is like pretty chill. It's
so
kind of awesome. Yeah.
It was my first one and I was like, low-key, the kids are just vomiting.
Yeah.
The kids are fine.
Every once in a while you get a
pro tip, wash your hands. Like actually wash your hands with soap and water.
Constantly.
Yeah.
Use the don't use the hand sanitizer because you get norovirus. Can't kill norovirus.
Yes. We were there together.
I think we
talked about this.
I think we might have talked about it, but I learned this. At some point.
But like
I've had
everybody
norovirus
had
twice.
Like flu.
What?
Over there. I'm like,
working at the daycare.
I don't want flu.
And vomiting and also the occasional laceration.
Yeah, I didn't get any of those, unfortunately. We did have,
my daughter had to be held down. My baby daughter had to actually be held down to get stitches on her face because she was like, suddenly became the Incredible Hulk at like 3 years old.
Yeah.
There were several people holding her to get stitches
Oh
on.
no. They didn't give her like the swaddle thing.
I don't remember that happening.
Dang.
It took 5
was a long
people
time
to give
ago.
my sister a shot when she was little. She'd get under the desk and like get the rolling chair in front of her and use it as a weapon.
Oh, heck yeah.
Drag her out. Somebody grabs an arm.
Honestly, good for her.
No,
she was
kids are
going down
crazy.
kicking.
All right, next one.
Did you know that if your armpits stink really bad, or if you have really bad breath, or if your face tends to get super puffy, or you can't get rid of that stubborn fupa, maybe things like hair loss or hair thinning, or you have no energy, and it seems like no matter what you do, you cannot get a restful sleep at night, or maybe even constipated, or you have issues with brain fog and struggle to remember things. These are all potential and possible signs of having high cortisol, or also known as the stress hormone. Shilajit has been my favorite way of helping me lower my cortisol levels. It is super easy to take. You just take 1 small spoon a day. It contains vitamin C, folic acid, vitamin D, and so many other essential vitamins and minerals that are known to lower cortisol levels and improve overall health. It's gluten-free and vegan. Since I started taking these, I no longer overthink the little things that I used to. Generally, no more brain fog. I feel super refreshed in the morning and I'm starting to feel like myself again. I take them all the time to help me stay calm. 1 bottle from Pure Shilajit will last you an entire month. If you want to try Pure Shilajit, you'll find it in the link in my bio.
First of all, I feel seen. Because I also stink like shit. I am constipated. My brain fog. Fupa. You know, like Jesus Christ. And I love the delivery is amazing. This is what the delivery is what truly made me go. I need to send
Jeff
this in.
Goldblum. Doesn't he look like Jeff
I don't
Goldblum?
know, but what I like is that he's back to his old self. Like before, he was like.
And he generally has no more brain fog.
Yeah. I mean, he is the picture of, what am I trying to say? Vigor, excitement.
Wow.
You know, like he's running on all 6 cylinders, you know, like
behind the eyes for sure.
Yeah.
I love the music.
Yeah, I was like,
the music.
why is this ethereal, like soul-bending music playing with like, do you smell?
Yeah.
Do you struggle with your armpit smell?
But like they were all completely unrelated things too. Like,
That's what you think, but let me tell you something, Fallon.
Shilajit.
They're all caused by high cortisol.
Oh my gosh.
You didn't know? They don't teach you that in med school?
You know what? They didn't. And they certainly didn't tell us about this miracle drug.
Well.
Maybe I need to have more pharmacology classes.
Wow.
That's a fungus, right?
I have actually no idea.
I assumed it was a fungus.
Is it?
So this guy, I'm not positive if it's this guy or not, but I was on like Family Med in the summer, and we had a patient who found somebody on Facebook who like gave these sorts of
this is what I'm talking about.
And then they'd buy like all of these supplements off of whatever you call it, and like I don't remember. Oh, I think he was using it for his diabetes because it said
Lord.
like, you know, you can use this to like lower your blood sugar, and he'd keep on coming in and his blood sugar was like through the roof. And I was like, yeah, but like I'm using this thing from Facebook and they said it'd really help me. And like, anyway, it just was really sad. And he like obviously was spending a lot of money on it. And I was like, and obviously the doctor was sort of like, so
what do you do in that situation? Like, because if you tell them, look, you're doing it wrong.
So
I don't think they're going to respond all that well.
The way that the doctor had known this person for a long time, and he was like, look, you know, we've talked about this before, you know, like this isn't helping you. And like, that's not to say that some of the things that like this guy is selling, like maybe they could have some like mild hypoglycemic effects, maybe. You know,
but not enough
but certainly not enough, because like, let's look at your A1C. It's not anywhere where it needs to be. So like, am I positive that these things are hurting you? No, but like, this can't be the only thing that you do in order to, you know, deal with your diabetes. Otherwise you're gonna have a lot of other problems. So.
But that fupa is gone.
Yeah,
gone,
right.
baby.
Your hair loss,
That's
your
what I really care about.
You can't get a good night's sleep.
And I've been meaning to tell you that you smell like shit, but you don't anymore. Oh. Yeah, no, this is clearly an AI generated guy. Like, I can't imagine this guy existing in real life, being invited to speak about Shilajit or whatever, as is clearly implied by this clip. Like, nobody's going to be like, hey, you know what dynamic speaker we need?
Mr. Shalaget.
Mr. Shalaget. He is
We should reach out to
amazing.
him and see if he would be a guest.
Call his agent.
Yeah, Jeff Goldblum. That's who that is.
credit card's right here.
It's Walmart Jeff Goldblum.
I take health advice from Jeff Goldblum. Remember, they take creators out there, use Jeff Goldblum's face in your things. I'll do it.
That's true. If Jeff Goldblum told me to do something, I'd be like, yeah,
I'd do
all
it.
right. Sounds good.
Let's see, 36. Okay. Next.
The average apple in a grocery store is over a year old.
Are you kidding me?
No, there is no mold. There is no fungus. There are no bacteria. They are perfect. Now, if a mold or bacteria isn't interested in eating those things, why in the world would we put them in our mouth?
What the hell?
Are you telling me that it's just the fact that I take them out of the grocery store that they start to rot in my fridge?
What the hell? This flies in the face. Yeah, the grocery stores have finally perfected the never-ending freshness technology that they needed. But once you get it out of the grocery store, it's
That's
all over.
it.
It immediately starts to degrade. And
Get wrinkly and smushy.
Yeah. I mean, sometimes I pick up bags of apples and you know, you have to look.
No, I know.
So
I just love that we're taking nutrition advice from like Colonel Sanders now.
Yeah.
That man was Colonel Sanders, I'm pretty sure.
I mean, seriously, anybody can put on a suit these days, I suppose.
Right.
Just like,
is there any truth to the idea that if fungus or bacteria don't want them, we shouldn't want them?
Well, I mean, there's like that thing where if you put like a McDonald's sandwich or whatever, or like a Twinkie in a box, it like never actually like gets moldy or whatever. Like,
really?
But Maria, I still want those.
Have you tried this?
I haven't personally, but like I know there's a theory, so like I don't know.
Well, there's
how
a
much
famous documentary from the early.
Is it Super Size Me?
Super Size Me.
Yeah.
My mom made us watch that, and I was like, I'm never eating at McDonald's ever.
And,
yeah. She also didn't
was that
let
true?
us eat at McDonald's, so.
Was that true that you never ate McDonald's again?
I think I've eaten McDonald's once.
Okay.
My mom was not a McDonald's supporter.
Dang.
Yeah, we were not allowed to have McDonald's as kids.
Yeah,
We had to watch Super Size Me. They played it in our like health class.
Oh my lord.
Yeah.
When he
elementary school.
vomits, ugh,
Yeah.
so gross. But
Yeah.
I think, did they put that in Super Size Me? Like because they had the whole thing of like the chicken nuggets are all the same shape or whatever. So like that's like sketchy, which like I could get behind maybe.
Well, we'll be talking more about processed foods as we continue today's show.
Oh, really?
I'm certain of it. I don't know. Like,
I can see what he's saying of like, well, if not even like if this food isn't even going bad,
Yeah.
like, should we be eating it? But like I don't think that I don't know.
I don't think that applies to
apples.
Apples,
Right,
I don't know about
I'm
that.
with you.
Yeah.
I'm with you. Like,
Yeah.
I don't know. Pringles, I don't think.
Sure.
Right.
Yeah.
Like,
Just because the fungi don't want the Pringles doesn't mean like
Right.
we shouldn't be eating them.
Yeah.
Are Pringles
Well,
delicious? Yes.
yeah.
But like,
Yeah.
also, should I be eating them?
Probably not.
Yeah.
But for different reasons.
Right. Right.
Yeah.
Yeah.
Also,
Throw it
Dave,
out right
would you
after
be
this.
willing to sacrifice your office to a box with a Twinkie in it?
sure. Sure, let's.
Like just block off one of the rooms. Like don't go in there.
Experiment in progress.
I do like
Level
Twinkies, though,
3,
so there's a good chance that the Twinkie will not last for.
Well, like, what
Dave
if we
is
put
the
it in a what if we put it in a cardboard box and it was unwrapped?
Okay, let's move on to the next one. Here we go.
You sit like a shrimp all day. I'm screaming, but you don't listen. Sit straight, or I'll make you regret it at 40.
You type for hours without a break. I'm inflamed and you ignore it. Rest me now. Or hello, carpal tunnel.
You've been looking down for hours. I'm not designed to hold your head at this angle. Look up or enjoy the chronic pain later. Been sitting for 6 hours straight. I need you to move so I can pump properly. Get up and walk. You breathe like you're afraid of air. Shallow breaths mean less oxygen everywhere. Breathe deep or stay tired forever.
Jesus.
Oh my God. That was horrifying.
I hated that.
I kind of liked that.
Can we go back to the spine with the spine coming out of its pelvis in a very inappropriate looking way?
I didn't even think about that.
That
was a very long tailbone. I will say that. Yeah. Yeah.
Jesus Christ.
Yeah, I hated that. It
was worse than the other one.
I thought it was funny.
The other one was
funny,
cute.
but also horrifying.
Yeah,
that's fair.
Maybe you want to cry a little bit. I was like,
I know.
So
I think I
mean.
just have like a visceral reaction to being yelled at.
Yeah.
That's what it is.
Yeah.
Childhood trauma, I suppose.
We've got enough.
Aces.
We got enough being yelled at in the real world. We don't need our organs, our actual organs yelling at us.
Yeah, I don't know how I'm gonna deal with angry patients. I gotta.
Yeah, you better.
It's gonna make me feel a little teary.
I've only seen nice patients so far.
Yeah.
Oh, good. There's
I've
hope
only
for
had
me.
one patient yell at me, like all of Courier.
Wow.
What did you get
That's
yelled
insane.
at
Yeah.
I'll tell you about it later. I don't think it's something
Not
that I
for the
can
pod.
share on the pod. Yeah.
about? Okay.
Wait, can I interrupt?
Yeah.
You know Catherine O'Hara?
Oh.
Yeah.
She just died. I know.
What?
I know.
Wait, how old was she?
She was 71.
What?
That's young. I have no idea. I just saw the news thing.
Oh my God.
That's sad.
Let me
You
read
heard it here first, listeners. A week from now.
Oh no.
Isn't that so sad?
She's so good.
She is so. Oh,
She's
she was
amazing.
so
So
good.
funny.
Now you're-
Moment of silence.
There's no cause of death
Moira.
reported. Moira, I know.
Moira.
Alexis.
No, I will say the heart. Going back to the video. Sorry. Rest in peace. Sorry.
I felt like I need to share it.
So
Public
callous.
service announcement. Back to the video though. The one of the heart really got to me because I was like, dang, I really did sit for 6 hours today.
You are correct.
I feel called out on that one.
Yeah.
That was a little motivating.
The oxygen one, like the lung one, I was like,
let's talk about this. This has been a thing that I've read about for years where
You should take deep breaths.
if you take deep breaths, it's better for you. Is that
It's true. It prevents atelectasis in the bottoms of
prevents what?
atelectasis. So
Say that 5 times.
your
Atelectasis.
little- like your lungs, right?
Yeah.
They're made of alveoli, and then all the way down at the bottom, the base of your lungs. That's where like you get, pneumonias and crap for the most part.
I see.
But if you take big breaths,
Okay.
it blows up your lungs all the way down. Instead of if you take like shallow, crappy breaths, you only are blowing up your lungs like part of the way.
Okay.
And so they keep,
But if that were true, pull your mic back in. Don't forget. If that were true, wouldn't we just want to take deep breaths?
Oh, good point.
Nobody's running around going.
Well-
in fact, if I'm in a meeting with you and you're like, I'm gonna be a little distracted.
So you're probably getting the appropriate amount of oxygen to your brain and muscles and heart and all of those things, not going right.
I would hope so. Yeah.
But you would also think that if you're getting at least a little bit of moderate exercise, once to twice a day, you should be doing that.
There you go.
Yeah.
Okay.
Oh, but it's like patients in the
That's
hospital
why-
who've just had surgery. You have to make them do that little weird
Incentive
Yeah.
spirometer.
Yeah.
so that they don't give
that's why,
themselves
like,
pneumonia.
old people, if they fracture their ribs and they can't take a deep breath, they get pneumonia and they're more likely to die. I learned that
Yes,
yesterday.
ma'am.
I broke my ribs in elementary. No,
Did you get
Yeah.
pneumonia?
I did not. But the doctor was like, "Take deep breath right now." And I'm like, "But it hurts." So they're like, "You want to be sick? On top of this, you want to be coughing? Take a deep breath." And I'm like, "Okay."
Were they talking to you like that?
That's what it felt.
Take deep breaths, you moron. All right, next one. This is the new dietary guideline for Americans. Not necessarily, not a video, but from everyone's favorite medical health influencer, Robert F. Kennedy Jr. and his Department of Health and Human Services. Fallon, you wanted to talk about this a little bit.
So the reason why I brought this up in the first place is because on my Facebook, there's a lot, or at least there were a lot of things about beef tallow. So,
Oh my god.
right, like for skincare, for food, it's like a
Yes, among the
healthy-
recommendations are you should be using
healthy fats, including, literally says in there, including beef tallow
and butter.
and butter.
But butter. Okay.
Butter, fine, whatever.
What is what? Can I buy beef tallow?
Oh yeah.
Okay.
Can you?
Natural grocers. Oh yeah.
I've never.
Amazon.
Okay.
I just feel like that's
I'm
one
sure you
step
can buy
away
it,
from
but if you
being
go to the
like,
grocery store, where's the
use some
beef
bacon
tallow?
grease.
Right.
They have
Rub
them
it all
now.
over
Yeah,
you.
Okay.
I've seen it. I
Yeah,
think
just a little bacon grease on the face.
You know, my skincare routine in the morning is I wake up, I open my can of beef tallow and just spread it all over my face.
I literally have friends that
That's why I'm
do
glowing.
that, right?
Literally glowing because it's
Okay,
grease.
I have a pimple on my chin, but I don't do that. Maybe that's what I need is some beef
Throw
tallow.
some beef tallow on that.
Anyway, this
great for,
drives me
sunburn.
bananas.
Yeah. I don't
might
know.
be.
Okay, and so my mother does a little side hustle. She does like beef tallow skincare. Okay, so she's like on the beef tallow skincare train.
We have an insider.
So, yes. So like I have not asked any dermatologist or like looked in the literature of like, is this actually effective? But she swears it works, and like all her friends try it, and they say like it, like they see
Works
benefits.
for what?
So like for just for their
looking your skin looking better?
maintaining their skin. I don't know. I'm not saying
That is
like
so interesting.
I feel
have no
like as
idea.
long as you're not eating it, like
I feel like it's not harm. I don't know if it's harming, but yeah, I don't know if it's like
feels like it would clog your pores.
Listener,
That's
listener,
how I feel. But
maybe
listener, if you have scientific evidence, I'd like to
please
know about
maybe
it.
also like their mom, so like their skin is like needs like
some extra.
Oh,
like your
yeah.
her like
right.
Yeah, the rationale I think is like it's because it's a fat, like it's like fat soluble vitamins and like helps to get through like fat soluble vitamins. But yeah, I don't know if that's how vitamins get through the skin barrier. Like I
like your mom by default. It doesn't really
very
matter
sweet.
Yeah.
if
I do love
the
your mom.
beef tallow
Yeah,
thing
she's
is
really.
And you know what? Her skin looks great.
Yeah,
She does. I know.
I'll tell her you said
Yeah.
Maybe she's fine.
He says
Well,
mom
yeah,
is great.
I try to
He
be
says mom is
supportive
very cool.
daughter. Like, I'll try it, but sometimes like
We
I
need to
do
do-
feel like I just am putting beef fat on my face. It's kind of weird.
You are.
Yeah, and I am.
What's happening?
We need to do a test. We need to do like a Shortco podcast long-term
But only put it
longitudinal
on
study.
half of your face.
Yeah, so that half of your face is
Left
like,
half.
half of your face is like normal human growth, and then half of your face is like glowing beef tallow gorgeousness.
Yeah.
Interesting.
But going back to this though, like I don't know if this should be like place beef tallow like in the food pyramid.
I
Like,
do love the fact that there's a whole rotisserie chicken just right there.
Right next to the broccoli. I will say at least fruits and vegetables have moved their way to the I guess the top.
But isn't
But also
that's what you're supposed to
the
eat less?
Prior, so the original one was upside down, and it was like whole grains and stuff at the bottom, and then the next one was vegetables and fruits, and then the next one was like dairy.
Yeah.
I didn't notice.
Anyway, so
I don't get this pyramid
I don't think the pyramid
structure.
not
I mean, it
how
seems
they
to be
really
divided in
make
half.
Sense.
it does
seems
seem
like
like
it's
that.
they looked at the original one and they said, okay, we're doing triangles, but they didn't think past like what the triangle meant, and
just-
then they just
kind
put a whole
of-
bunch of food into a triangle.
It just kind of looks like they were like chat.
Yeah, guaranteed.
Yeah.
Guaranteed.
yeah.
I could make this food triangle in
Low
like
carb.
3 seconds now.
Right.
But yeah, low carb, high beef tallow is sort of. I don't know.
Yeah, no,
I will say that there are broccoli. Like I'm not an unfair person. There are vegetables up there.
Oh yeah.
there's a whole 4 blueberries.
nice
on that.
head of
There is a whole
broccoli.
but I don't know. I just
and then
feel
there's like a whole chunk of steak.
Although I will also say like the way that we read, we always read left to right, which means that like the first thing that you read
Steak
will
first.
be like protein, dairy, and healthy fats should be the most important thing. And your brain does also tend to go down instead of to the right. So I don't know, just based on how
But like the right side is more like bright. So
That's
that
true.
Does like pull. I have no.
There
it
is
looks
a
like
way
chat.
to
Psychoanalysis.
there is a way to analyze using special glasses, like where people look at images or websites. Use it a lot for websites and things like that. It would be interesting to take what you just said and test it out on
On
this
this, yeah.
and see what people are drawn to the most.
that actually would be very interesting.
Yeah.
I agree.
And then test if it actually like influences their
Yeah.
like
Corey,
perception.
Isa, this is your summer research
Yeah.
project.
Okay, all right.
SRF proposal.
baby. Here we
Yeah,
go.
for
Writing that up.
summer 2026. You can list the Short Code podcast as a co-author.
Oh, please
wow.
do.
We will. We can come give our presentation
Put
here
me
on
and
the
Fallon
pod.
as.
I will let you choose. Yeah, I will let you choose which of
You
the
can make me
co-hosts
the
come
last
first.
author. I don't really care.
All right, next.
I told a pediatrician no, and it's all thanks to the breastfeeding mama talk community. So my son was induced at exactly 37 weeks for risk of preeclampsia. He was born just a few days ago on 1/24/18. He latched on right away, no problem at all. The next day, they checked his sugar because they said he looked jittery. It was low, so the on-call pediatrician came in and said I needed to give him formula to balance his sugar levels. I refused. The look on her face was priceless. She looked pissed, like no one had ever told her no before. She said, "Fine, I'll send in a lactation consultant," and leaves. Then my nurse comes in and says that the doctor wants 3 sugar readings throughout the day, and if he passes, then he can go home. I said, okay, fair enough. So the lactation consultant comes in, checks his latch. Perfect. So she has me pump for 15 minutes to see how much baby is getting. I pumped 15 milliliters. I was even amazed, as was the consultant. 3 sugar tests later and we came home, no formula. My nurse applauded me and let me know she was so proud that I told the doctor no and raised his levels all by myself. It's true what they say, your breast milk knows what baby needs. Thank you, ladies, for giving me the courage to stand up for breast milk.
That demon baby was kind of cute.
Oh, okay. The demon baby really upset me, actually.
Same, I was like,
I'm sorry.
it was kind of cute.
It's not real, Fallon. It's not a real.
Gonna go home and have nightmares before step. Jeez.
Yeah, for our non-video listeners, I took some liberties with the image for that. Fallon, you sent this one in, I think.
Yeah. So the truth is, like, I don't necessarily think it's like a terrible thing, right?
No,
like,
I mean, breast is best. That's what.
Yeah.
I mean, I think we kind of know that.
Fed is best.
Fed is best.
Yes. Also. That.
But yeah, I mean, like, your breast milk is the, like, you know, it's meant for babies.
Yeah.
Right. Okay. Human babies.
Thanks for clarifying.
Yeah. Anyway, I think the thing about this particular post that really bothered me was that it set up the patient and the doctor as like enemies instead of a, you know, 2 people that should be working together in order to, you know, both help mom and baby. And I just think, like, I don't really know that Facebook should be trying to promote that kind of thing. And I know that it's very easy to go onto Facebook looking for like support and like, hey, has this ever happened to you? And like, I need some other people to tell me about their experiences. But I think it's very easy to get into that cycle of like, oh, this is bad. Like, you can't trust these people.
2 things about that post that aren't readily apparent from how I've presented it today. Number 1, it wasn't clearly a testimony from an individual because it was posted under this breast what is it called?
No, it was like breastfeeding
mamas talk, I think is the name of the group. Mm-hmm. So it was the actual group posting this without any attribution. So it wasn't clear that this was an actual person's testimony or whether it was made up. And you got to be skeptical about this sort of thing on social media these days, right?
Yeah.
And there was a disclaimer. The other thing is there was a disclaimer at the bottom that was like, you know,
yeah, this isn't for everybody.
Blah, 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 blah. But yeah, there's a lot of guilt in being, there's a lot of unnecessary guilt in being a mommy that I wish we could just.
I think that's fair. The other thing I will say about this post, though, is like maybe it gives OBGYNs or pediatricians even the opportunity to be a little bit more, I don't know, understanding of patients who are like parents for the first time and don't really understand what's going on, or just patients.
It is a freaky time.
Right. Yeah.
Being a new parent.
So I don't know.
I remember the meconium really blew me away during that. I was like, Christine was laughing at me because I was like, it's everywhere.
Oh, my brother came.
I'm so useful as a new father.
Was this like as baby was being born, or was
no,
like
the first time the baby needed a change.
Oh.
And it fell upon me for obvious reasons.
As it should.
And I completely decompensated, had milk.
You were doing your best.
The second time I had a migraine. So my wife sent me home. Yeah, it was bad.
Dang.
It was bad. I'm not a good.
What a useful
I am not a good
parent.
I got better later. It took a long time.
Oh, Dave.
Some people just aren't naturals. Okay, that's all I'm gonna say.
Your kids turned out fine, right?
They're all right. Okay, I think this will be the last one because I understand that some of us have to go. Maybe
you have IPE at 1.
Yeah.
Oh, do you want to?
Oh, it's already 1:01.
It is 1.
Do you have IPE?
Yeah, I thought. Man,
you have your IPE. Is
yeah, I'm supposed to be on Zoom right now.
Oh yeah.
Yeah, go ahead. Don't get.
Okay.
Yeah, you guys.
Well, thank you guys.
Nice meeting you.
I literally I thought, oh yeah, 12
Have
to 1.
so much fun.
It's gonna be great.
Go get interprofessional.
Just
educated.
They are waiting.
Don't listen to them.
Please leave.
Bye, Issa.
Bye, guys.
Don't trip on the cord.
All right, so we'll do this last one.
Funny.
If you don't understand the rules of power, you will certainly lose to someone who does.
Has nothing to do.
I'm going to teach you how to be more powerful.
Definitely pepper.
Because power leads to success. Some of the things we're going to talk about having you do are going to make you feel uncomfortable. If you think hard work, loyalty, and waiting your turn will get you promoted, you're dead wrong. If you don't understand corporate politics, people less talented than you will take your promotion. Most people wait for permission, they wait for direction, they wait to be told what to do. Power favors those who move first. Attitudes follow behavior. So if you want to get rid of imposter syndrome, stop acting like an imposter. Don't resent power. Don't resent the people who have power. Master power. I'm Professor Jeffrey Pfeffer, and this is Masterclass.
Yeah, this comes up in my feed constantly, and
Masterclass.
This guy.
Oh.
I'm not sure what that says about your watching habits. That
I don't either. Like somebody out there knows. I mean, okay, so
they're in your psyche.
I would like to say that I think I think this guy makes me very uncomfortable. His presentation
makes me a little uncomfortable too.
But I also think he might be right.
Yeah, I think there's some truth to what he's saying.
I would agree.
I just don't think. I don't know that it feels like the type of information that maybe like you have that conversation with your kid or something. Not like we're gonna just tell everybody this.
It's too late for me.
I don't know. I do
have that conversation with my dad and be like.
I do think it's a presentation thing that like makes me uncomfortable because I think the message, if somebody like was sitting in like a calming chair and was like, hey, if you're feeling like you don't belong, maybe the first step you can take is like acting like you belong. I'd be like, yeah, that's nice, but this man is yelling at me and I don't like it.
Yeah.
If
you think that you can just do nothing and get ahead in life, I'm gonna smack you in the face.
Right. That's the vibe.
Well, he also kind of said like you can't win power by playing by the rules and being kind and like all the things that you kind of hope that all the people in power should be.
But he's right though.
Professor Pfeffer, he knows what he's talking about.
He is right.
Yeah,
except for good old Tim Waltz.
There's a whole lot to do with connections.
I mean, I say this. I wasn't sure this was relevant to our discussion, but imposter syndrome is a thing among med students, and it's a thing among people like myself, and I continue to suffer from it even after all this time. But I also have learned to some extent professionally that sometimes you just got to do shit. Don't seek permission. You just got to do it. This podcast is one of those things. If I had started this podcast in 2010 by asking a dean, can I do this? I'm pretty sure I would have had to write up a proposal and bring it to the council.
Sounds like way too much work.
And go through risk management and blah, 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 blah. And it never would have happened.
That's
true.
That's fair.
I wouldn't be in Iowa
or maybe
right
not.
now.
Like, I don't know. You wouldn't what?
I would not be in Iowa right now.
So, yeah.
Were you a short coat? Crazy.
I was a short coat. I'm not even from Iowa. Did not even know where Iowa was, actually. Thought it was where Idaho is.
That's fair.
Oops. So, But now I know very much where Iowa is. And Idaho.
You've really come a long way in your knowledge of this United States geography.
Yeah, potatoes and pigs. Yeah.
And it's all thanks to me.
Hey, there you go. And not asking and just doing.
Yeah. I mean, yeah, you gotta moderate that advice a little bit.
That is true.
You know,
right? That advice in the wrong hands.
Yeah. Wow.
Sorry, ask first.
But somebody just today was talking to me about something that they wanted to do. Or I said, we should do X. And they were like, well, I'll bring it up with the group. I'm like, just do it. You don't have to bring it up with the group. Just do it. It's fine. Well, I think we've reached the end. We've reached the end. Before I go, Fallon, I'm told that people love to watch videos of podcasts. What podcasts do you watch on video?
This one.
No.
You're right. I don't watch podcasts on video. I'm sorry, Dave.
The various titans of tech say I have to have a video version of the podcast.
It is becoming increasingly popular.
Yeah.
I give the billionaires what they want.
Wait, Dave.
What?
Netflix has podcasts on it now. I saw this last night.
Oh, I should make sure it's there.
Yeah, just saying.
I think they might be curating their podcasts.
They're podcast curious.
I think they're like picking the fancy podcasts.
Right. Oh.
And we're fancy, but not that fancy.
Gotcha.
I'll look into it though.
Okay.
Yeah, I want to give the billionaires what they want. So we are on YouTube. Our Spotify episodes also feature video, though sometimes the version is delayed from the audio version because Spotify's video upload system is fakakta.
Oh, I love focaccia.
Not focaccia. Fakakta.
Oh.
Anyway, if watching people have a conversation floats your dinghy, and in today's show, that just might be the kind of thing you want to do because we're reacting to social media vids and, audio podcasts. I don't know. Then what right do I have, I ask you? What right do I have to stand in your way? Look us up. Look in the show notes for the links. Capiche?
Capuche.
Capuche. That's it. Shortcoats, if you have something you want to say about today's show, about something you want to hear about someday, a question you have, go to theshortcoat.com/tell us. Theshortcoat.com/tell us. And send us a message. Otherwise, you guys, thanks for being on today's show. Really appreciate it.
Thanks for having us, Dave.
It was fun.
Anytime.
Until next time, I'm Dave Etler saying don't let the bastards get you down. Say bye, everybody.
Bye-bye.
Bye, everybody.